AM 1220, KHTS, hometownstation.com. I am T here with you every Thursday, noon to 1, with a program, Dr. Proctor, that gives us an opportunity to kind of glance over the shoulders of the medical community and the professionals to see basically what it is they're doing. We live in a time where doctors and hospitals are incredibly impacted right now, and the chance that we can learn a little or at least know the conversations to have when we go in to see the doctor, a little bit of an education to help us be our own best advocates. With me today, I have Dr. Thomas Kurian, who's here. He's an adult and pediatric neurologist. He has a practice here on Lyons Avenue in Santa Clarita. If you ever need a board-certified adult pediatric neurologist, this is the gentleman to see. Dr. Kurian, thank you so much for being here today.
Thank you for having me.
Now, one of the things I'm so hoping to talk about today is there's a movie coming out in December starring Will Smith, and when Will Smith gets behind a movie, people are going to be talking about it. Whether they see it or not, you know, that's to be decided by the audience, but the conversation, I think, is actually really wonderful. It's a movie being released Christmas Day by Sony Pictures called Concussion, and it's all about the idea that athletes should be looked at for traumatic brain injury and issues that maybe before we had not really looked at. And I've brought you in today to have a little conversation about traumatic brain injury. But first I want to talk about the idea, because I do love this. You are a graduate from Hart High here in the Santa Clarita Valley. You were actually born at Henry Mayo. I asked you if you were 12. I didn't even realize the hospital was as old as that. So you not only were born and raised here, you have your practice here, you have your life here. Thank you for what you give to your community.
No, it's been great to come back home. You know, my parents are still here, my sister's here, all my high school friends are still here. So it's been the greatest joy to come back to Santa Clarita and help out in the community that helped raise me. So
I love that. Well, tell me a little bit about your background, how you came to medicine, and a little bit about where you studied and how neurology became your specialty.
I mean, it's, basically went to Hart, graduated, wanted to see a little bit of the rest of the country. So I went out to Chicago for undergrad and then went overseas for, my medical training, did my residencies up in New York, and then moved down to Georgia for my neurology residency. And, it's just been one of those things where neurology's really been something I've been interested in since a kid. The idea that you can replace a heart, you can replace a kidney, a liver, you can replace most things in the body. You can't replace your brain.
The brain is the main operating unit, and once that's done, you're done.
Exactly.
And it takes everybody else with it.
Exactly. And, we often, and we don't know that much about it. We're learning so much, it's still so early on, really. Some people say neuroscience is the last frontier of medicine, and that's probably true. And one of the big things that we're focusing on now is concussions and traumatic brain injury, because we're just learning so much about it. People are coming forward with the impact that it's had on their lives, and we're starting to realize that this is a major problem out there and that we don't know really that much about it.
The brain is the great gray planet. There's so much that there is to be discovered. Well, traumatic brain injury, as I said, this is, the other question, were you ever involved in sports when you were going to Hart High?
I was. I played tennis for them. Luckily, I don't think I sustained any concussions playing tennis, but a
lot of the sports out there, kids are subjected to some pretty serious injury.
No, they are. And I feel like I did have one skiing. I was up at June Mountain, and don't remember all of it because I fell down the mountain, tore my ACL, can't remember the event. And at first I thought, okay, I just hit my head, that's no big deal. This is before med school, before, we really learned all about this. And when we start going back and looking at what concussions are, you realize even as a doctor, you're like, wow, I did have a concussion back then.
Well, one of the myths that I certainly came into this today before we went on air, you talked to me about this, it's an injury resulting from a violent blow or jolt to the body, not just the head. And I have lived my entire very long gray life thinking that concussion or traumatic brain injury was when you would actually hit your head, but that's not true. Just a jolt to the body, ranging anywhere from that can affect the patient from mild with a bit of dysfunction temporarily to long-term complications and even fatality. The idea of of any kind of brain injury, not just resulting in a head injury. And as you're saying, some people can sustain this injury and not even be aware of it.
And that's very true. We're starting to realize, or I guess one of the big things we're trying to come out with is an accurate definition of what a concussion is, what is traumatic brain injury. And we're starting to get there because we're starting to understand the pathophysiology of what's happening to an individual when they have a concussion. Now, mild traumatic brain injury is really any kind of external force that is implied upon the body that really causes the brain to stop functioning in its normal way for anywhere from milliseconds to more than just that. And concussion really is more of a syndrome. It's a constellation of symptoms that happen after some form of a brain injury. So
Give me an idea of some of those.
So, one of the ones that we really see most common are high school football players. They're going out, they get hit. Some of these guys, they won't get an actual head-to-head or helmet-to-helmet contact. Someone will hit them in their chest. They'll kind of whiplash back, fall down, hit their back of their head, and they'll get up, they'll walk around.
Brush it off.
Or just brush it off, and just keep going. But when you really look at them, when you look back at the video, it took them a second to get up. They seemed a little wobbly when they were getting out. When you talk to them, they're like, yeah, I saw some stars, I saw some floaters in my vision. Those are symptoms that we're realizing are part of the syndrome, the concussion syndrome. And it's going to be, we're really trying to work with, coaches and everyone to help individuals realize, hey, look, he may have a concussion, some form of brain injury. Let's get him out. Let's evaluate him. Let's take a real closer look. Then, okay, he's up, he's walking around, he looks good. Let's do the next play.
Right.
Because it's going to be very important to remove that player from play, really assess them, evaluate them, make sure they're back to their normal selves before we let them get back into play.
So here's the minor aspect on that scale. And then we were talking about more serious.
Yeah, more serious concussions can happen when there's more dramatic brain injury that's going on. You can get a loss of concussion. It can be, loss of consciousness, I would call it, and it can last anywhere from just several seconds to there's individuals that if it's severe enough, they could be comatose. They could go out, in which case it may not be just a concussion, maybe more than just that. But, these things can be serious, and we need to evaluate these people emergently.
Well, one of the things we constantly have the reminder of the athletes, and again, with the movie that's coming out in December, absolutely we know that football players, hockey players, people in mixed martial arts, boxers, these people are at risk. And so athletes, most certainly, because of sports, the practice or equipment failure. Children, little newborns to 4-year-olds, and then the young adults, 15 to 24, who might sustain an injury in play or, doing just riding their bike, various different things, not jumping on the bed. No more monkeys jumping on the bed. Then we also have, accidents where people are vehicular or job site, home and violence. Veterans, I'd like to talk a little bit about soldiers in combat situations, because that I knew of it, but when I started to realize some of the things that I had not considered that could be an issue, and the elderly, where we think of a fall or due to imbalance or interaction of medications or some such thing, I had always thought of, a broken bone, or I had not thought of the idea that brain injury was part of this. Talk to me a little bit about, because again, we spoke a bit before about veterans, and when they get hit with, sometimes it's just the shock force of something.
That's correct. It's really, you don't have to have a direct trauma to the head. You can have, like we said before, the football player who got hit in the chest. It's the whiplash. It's the actual forcing of the brain to move in ways that it's not.
Because it floats in there.
It's it's kind of like Jell-O in a bowl.
Right?
It's going to wiggle, and when you really look at it, say your skull moves forward, your brain's going to most likely move in the opposite direction, and then it's going to kind of move back and forth and rattle around in there. So you're going to get damage to multiple portions of your brain. Even though
we have this nice casing, and we have the fluid, the idea that brain it floats in that space.
And it's prone to injury, and it's not a perfect environment to protect us against this. It's meant to really sustain us from major blows, but even minor ones can cause disruption in the functioning of the brain.
And again, the myth of hitting your head, for me, was always like, oh yeah, that's what I thought. And then I realized, no, just that idea, like you're saying, that the brain gets jostled in such a way that there can be an injury from that. When you're talking about assessing like these players that get up off the field and you have to see them, for the most part, I can tell you when I was a kid, I took a hit, and my parents totally thought I was faking. Oh yeah, she remembers. Oh, don't listen to her. And for the most part, if a parent has a child or you have an older relative or someone's been in a car accident, it's probably a good idea to see you guys, isn't it?
Yeah.
Just to be seen so that you can assess what is going on, the physical, the sensory, and cognitive. But rather than go to the doctor, are there some things we should be looking for before we pick up the phone and call you?
Well, the important thing to realize with a majority of these injuries, barring a major injury, a slip and a fall, a falling off the bed, those types of things, you're going to have some symptoms afterwards. You may feel dizzy, may see some stars. You may feel a little nauseous, that kind of sick to your stomach feeling after that hit. You may also not really remember everything that's kind of going on. A lot of those things are part of the
expected.
Yeah, they're part of the normal symptomatology of the brain.
Don't flip out.
Yeah, exactly. What we're really looking for in individuals that come to our practice is these things are not getting better over time.
And what would time indicate?
Usually anywhere from 2 to 4 weeks. We say that about 80% of individuals should get over, if there is a concussion, their symptoms within about 2 to 4 weeks. Persistence of those symptoms beyond that time is when we need to start considering, look, we may need to start some medications to help you get over your symptoms. We may need to cut back on some of your activities. We need to start
Gotta let the brain heal.
Exactly. We've actually found a lot of good things about that too, and interesting things too. The initial thought was, okay, he got hit or she got hit, and we'll get to that also. But it's not to lock them up in a dark, quiet room right after.
And then there's the old, a lot of us were raised with the don't let them sleep.
Yeah, exactly. And that's there, but that's more looking for if there's some late bleeding in the brain.
Okay.
And so that's it's a concern, but it's sometimes maybe a little bit more exaggerated because we see that in TVs and movies. We're like,
right.
Okay, we're not supposed to let them sleep.
It's so dramatic.
Yeah, it's just you want to always check on them, see if they're arousing, if you can get them up and move them around, but it's not like you don't want them to sleep at all, because sleep is restful. It is.
You got to heal.
It allows your brain to kind of heal and get over the things, and people are going to be sleepy after any form of a pretty decent sized concussion. Really what we want to do is just make sure that the patient can do the things that they normally do, that they're not just unarousable, they're just, knocked out. That's what we don't want.
Right.
But, really we're just trying to see how these symptoms are and whether or not we need to start instituting these return to play guidelines and things like that. We'll discuss that a little bit more later.
Okay.
With treatment.
All right. And so if we do decide, okay, somebody's taken that blow or maybe not seeming themselves and indicating, just like you're saying, they're not really recovering from that. When we bring someone in, you guys have particular tests and diagnoses that you will give a patient to determine what is going on. So, like in an emergency situation, if someone's been in a car accident, what can they expect? You're going to evaluate with, I know the Glasgow, there's a scale.
Yeah, there's a Glasgow Coma Scale, which is a 15-point scale that looks at different things. It looks at their level of alertness, their motor skills, their verbal skills, and it allows us to give a quick baseline kind of exam. What happened at the time? What are they looking for? The most EMTs and first responders, they will do these things. They're looking for individuals that have scales that are less than 13. That's generally kind of what we're looking at as individuals who may have sustained a little bit more than just a knock to the head.
Right.
That means there is going to be some dysfunction going on if they're not between that 13 to 15 or 8 scale points on there. So if that's the case, they usually do bring them into the hospital to get evaluated, see if there is anything going on. Obviously, the lower the score, the worse it is. We would have to do emergent imaging,
Right.
further diagnostic workup. The one thing that really a lot of patients are surprised at when they come into, at least to our office, so this is assuming the injuries occurred a couple of weeks ago, they're still with symptoms, they're coming in for further evaluation. There's actually no imaging out there that really shows us, okay, this is a concussion. When we do our CT scans, our MRIs, that's really to rule out any major structural damage to the brain.
Right.
So bleeding, a stroke, if anything like that could have caused some of these persistent symptoms, then that'd be the case. But a majority of those people, if those things are occurring, they're going to be much worse, and you would have
Right.
probably brought them into the emergency room anyways. So we usually don't even really recommend doing the scans unless the symptoms really have been progressively getting worse, if they're lasting much longer than we would have expected. Imaging really isn't our first choice.
Not the first go-to.
Yeah, usually what we're doing
It's
is
not going to show you what you need to know. You're going to
Exactly.
get that from your other assessments.
And it's just like everything in medicine, you treat the patient, you don't treat the numbers, you don't
Right.
treat the imaging, you look at your patient, you examine them, see how they're doing, get a good history, and
I
then go
like
from
that.
there.
It gives me confidence to know that that's the mindset of the doctor. If I ever, Dr. Kurian, I'm definitely coming to you.
Thank you.
Because I do like the idea that you're treating the patient. You're not just looking at a piece of paper or a scan and saying, okay, this is what we need to do. We need to take everything into consideration. If someone comes in and they've just maybe, a bink to the head, for the most part, and to be at home, I do want to talk about how we should be dealing with that at the home level.
Sure.
Before we come in to you. We're talking with Dr. Kurian. Again, he's an adult and pediatric neurologist. He has a practice here in Santa Clarita on Lyons Avenue. And we're talking about traumatic brain injury, things ranging from concussions or just again, is there a term for the bink to the head?
Just really kind of mild traumatic brain injury. There's a concussion. The government's come out with this whole new diagnosis listing thing called ICD-10. So there's a whole bunch of new codes coming out. We're still trying to learn all of them, and there's a million terms out there you can use.
You're never not in school.
No,
would that be
definitely
true?
not. Yeah, it's until I think the day you retire is the day you stop really kind of having to continue to learn. And
again, it gives me confidence in you as a doctor, because the idea that you want to continue learning, that you have, they do call it practicing medicine.
That's true.
You're still learning. It's a progressive, and I think we as people are changing too. Our environment, the way we make our way in the world, I think that makes it probably challenging for you also. So glad to know that you are still the person wanting to learn. And again, as we're saying, it's like the little gray planet. The brain is still kind of a mystery, and as you said, the last frontier for you guys to study and learn about. Do you ever at any time get up in the middle of the night and go, oh, I should have gone into podiatry, I should have done feet?
Well, not really.
You like what you do.
I like what I do. I've seen too many feet to realize I like the other end of the body more. So, no, I've never really regretted this, and it's been really a blessing to be able to come back and practice something I love in the town.
Again, I do love that you're here, and Santa Clarita in particular has so many sports. I mean, just from the school level where you have like football and baseball and lacrosse and a lot of these really intense sports, cross country even, and where I've seen some of those athletes take a tumble on the course. It's like, wow, how could they? That's a pretty good hit. So, and here where you are in this community, you probably see the whole range of the minor to the hopefully not too many of the major. So when we come back from the break, we're going to talk a little bit more about traumatic brain injury and various levels of it. We're going to talk about some of the complications that can come from sustaining a traumatic brain injury. We're going to talk a little bit about treatment and prevention and who are the guys to see, like Dr. Kurian, but we'll talk a little bit about not just the neurologists, but the actual rehabilitation process and some of the people that work here in our very own community to help those of us. You're here listening to Dr. Proctor. We're here every Thursday, noon to 1, here on your hometown station, AM 1220 KHTS. You can always find past segments on our website, which is hometownstation.com. Stay with me. We'll be back after these messages.